Hi guys, welcome back to Nursing School TV. So in this video, I'm going to talk about week 3 of nursing school. So week 3 basically went, Monday we had off, which was awesome. However, I did have my very first test this week, and stay tuned for that video because I'm going to make it right after this one. So we had Monday off. Tuesday and Wednesday are our clinical days, which is where we either go to the skills lab at our school or we go to a clinical location. So this was the first week we went to an actual location with residents. We went to a geriatric rotation is what we're on. We're on the geriatric rotation. And so Tuesday we got there. Our shift was from 2 p.m. to 10 p.m. at night, and then I live about 45 minutes away from the location, so I was getting home roughly around 11 each night, which didn't help with having to study for that test that I'll talk about in the next video. But so we get there, first day, we kind of just meet up. We have an orientation. We get to kind of walk through the wings, learn where stuff is, learn where the shower rooms are, learn where the crash cart is, learn where, you know, the vital sign equipment is. They don't have the ones hooked up to the machine. Everything was done by hand, you know, as far as the blood pressure is done manually. So we got to put some of those skills to use. So we basically walked around and we introduced ourselves to some of the residents. We kind of just went in there, we filled up ice cups, we, you know, assisted with a little bit of stuff here and there, but we didn't really do too much till the next day. So Tuesday wasn't too bad. It was kind of a learning little experience, just kind of walking around, talking to the residents, getting to know them, seeing what they're like, and just kind of getting a brief overall idea of what it's going to be like over the next 2 weeks. We're actually there 3 weeks, but we're only in one wing for 2 weeks, and then we go to another wing of the hospital, which is more, or of the residence, which is more of a acute care facility. So it's kind of as close as to a hospital as we're going to get this rotation. So Wednesday we actually got assigned to a CNA, and we basically shadowed them. And sometimes it was kind of interesting because we had to, you know, tell them, hey, I'm here to help you. Use me, you know, don't abuse me, but use me because I'm here to help you, you know. I'm here to learn. I'm here to get my hands on. And I have to say, shout out to you CNAs. You guys are amazing. I don't think you realize how amazing you guys are. And I don't think you guys get enough credit for how amazing you guys are. Each CNA that I saw had anywhere from 5 to 10 residents, and, you know, they have a short period of time where, you know, people are sleeping, and then they're having to wake them up, and then they're having to do brief changes, and then they're having to do showers, and then they're having to take them up to dinner, and then do the people after the showers, or bed baths, or get them whatever they need them, you know, and oh my God, they're just all over the place. And, you know, my first instinct was, how do they take care of all these people? And, you know, we're learning now about the quality of care and how compassion goes a long way, and how just, you know, being an advocate for your patient. But it's really kind of hard for these CNAs to have that one-on-one reaction, you know, interaction with the residents, because, you know, they're talking to this person and a call light goes off, and, you know, it's probably someone who's unable to use the bathroom on their own, and now they have to go over there and take them. And that's not just a here, whoop, whoop, going, good, okay, you're done, like you would with a little kid. This is, you know, a grown-up who is, you know, 100 pounds or so, and you're moving them into the bathroom, and you're, you know, holding them to make sure, depending on the level of function they have. And it's just, oh my gosh, they were all over the place. They were great. They were wonderful with us. So like I said, you CNAs definitely deserve a shout out. And from a nursing student who is watching you, keep doing what you're doing. You guys are amazing. So Wednesday night, like I said, we got paired up with a CNA, and, you know, I did feedings of residents, as, you know, one of my residents was unable to feed themselves, and they, you know, so you basically just feed them, you know, as if, you know, almost like a little baby you would feed them in a sense. You know, they need that sort of level of care. Then you had some patients that were, you know, 100+ years old and could stand up on their own, and kind of shift, their body weight around. It was just amazing to see the level of function variation between these groups of individuals, and it was just really eye-opening, and I really, really enjoyed it. We'll actually go next week for 2 more days to kind of help out on the unit as well. So it was a really great week as far as that. Thursday we had a short lecture after our test, and basically we're just going over the theories of nursing. So this week was really kind of more of a hands-on week. So stay tuned for my next video on the test, and I'd love to kind of explain to you guys what my first test was like.